Salams and welcome. Thank you for joining me in part number 16 of breast cancer basics. And today we're finishing the end of the psychology of breast cancer. Can look at cognitive behavioral therapy, CBT, professional help. CBT can help patients identify and modify negative thought patterns and behaviors associated with breast cancer and its treatment. This also varies from patient to patient, and some patients need professional help and assistance with regard to that. In addition, you can also look at support groups. This works fabulously well. You can have Facebook support groups, social media support groups. You can go into family groups and other support groups, either online or through regular meetings. For example, in Lodium, there is the Lodium Cancer Care Organization, which is a voluntary support group which helps many patients. So connecting with other women who have breast cancer can provide a sense of community, understanding, and shared experiences. So you can speak to other people who are going through the same things which you are going through. They can give you advice and tips, and they can fill your brain with positive thoughts and give you hope in the challenges that you're facing. And it gives more meaning to your challenges, because then you know that you are speaking to someone who has gone through breast cancer or is currently going through breast cancer herself. And thirdly, social support, very, very important and very, very powerful insofar as psychological motivation is concerned. Having a strong support system of family and friends. Family and friends can significantly improve a woman's ability to cope with breast cancer. Because at this point in time, you'll be feeling very low. As what you mentioned, some people go through an existential crisis where they start questioning the meaning and purpose of life. So whether you go through periods of depression or anxiety, you need a strong social support system where you need to unburden your thoughts onto another person without feeling that you are being judgmental or people are judging you insofar as your thoughts are concerned. And insofar as the diagnosis is concerned, many people react differently. Many people need a support of either their husband or the children or the best friend will come with them to the doctor, to the oncologist to get the first news. Other people like to keep the news to themselves. For example, we know some elderly patients, the woman would tell the other family members, please go sit in the waiting room while I first talk to the doctor privately. And the doctor will then tell the patient that, you know what, your cancer you've got is terminal, is advanced stage 4, you've probably got only a few months left. And the patient does not want the rest of the family people to suffer, so she would just then tell them, no, the doctor said everything is fine and everything will be okay. Right? So different people cope with it differently. Other people, it's better to always take someone with you as a friend or a relative into the doctor's consulting room, because many times when you get such a powerful news and such a worrying news that you've got cancer, then many people, they shut down. They can no longer hear what the doctor is saying, right? Because the brain is somewhere else. The brain takes time to absorb what the doctor is saying, because the minute you hear the word cancer, your brain goes into overdrive. Whereas your family member or friend who is sitting there can listen to what the doctor is saying, and later at home, when you have calmed down, then they will explain to you what was mentioned in the consulting room. So it is always a good idea, whether it is cancer or any other medical illness. I found that in my own practice as well, it's better always to take a family friend with, especially if you tend to forget things, because family friends will be able to, your wife or husband will know your full medical history, and there may be certain instances where you yourself may forget what that medical history is. But as what I mentioned before, every human being is different and it varies from patient to patient. But remember that support groups are very important. Stay well, look after yourself. Alhamdulillah Rabbil Alameen.